Madam Kate, if you would share the screen because the participant has arrived and seem to be ready soon. Buddy, I'm not sure if we can start now. Yes, please, because it's 9 a.m. already. Yes, please. I can hear you. Yes. Kate, are you ready? Yes, I'm in already. Sabadi, everyone. Sabadi. It's a good opportunity that we have met again in July. Is every first week of the month we are having a meeting, online seminar. First of all, respected the speakers, the participants in the meeting offline and Zoom nationwide. On behalf of Nutrition Center, it's my honor and I'm proud to welcome all of you to the monthly seminar in July. And our Nutrition Center, Ministry of Health, in collaboration with the Capacity Strengthening or ANRCB, has organized the seminar for every week of the month. And today is an important topic which Dr. Ketsadasak Kiettisak, head of the Health Promotion Program based in Plan International in Laos, would present the baseline survey results on improved access to health services for women, infants, young children in Salavan and Oudomxay province. The seminar is a good chance for all of us to learn, to exchange and listen and discuss various issues of the implementation in the two provinces. And Dr. Kate has experience in health issue in women, infants, and young children for a long time, and it's a good opportunity to talk to her. And if you have any comment, feel free to ask the teacher. By the end of the seminar would be conducted for an hour and a half, and I hope all participants would obtain new knowledge that could be applied in your work. And I wish all participants healthy and successful in your work. At this moment, I'd like to officially open the seminar from now on. Thank you. And I hand over the floor to Dr. Ketsadasak for her presentation. Thank you, teacher. Thank you for ANRCE, Nutrition Center, for allowing an opportunity to share the experience about our project, which is a baseline survey. This project received funds from Plan Germany, and they receive funds from their own organization, or the DMSS is the Ministry of Economic Cooperation, offering direct funds to PS and PFSA and plan ได้แล้วเจ้าพอดีเจ้า and plan receive fund and provide technical support to the two association for doing the activity. The baseline survey is the CBTS collected data and this the survey. And the area of the project is in Samoay, and which is 60 villages, and 10 villages in Oudomxay, and we don't do activity in the health center. And the overall objective of the project is to contribute to improve access to health services, reproductive health, and reduce mortality of mother, and reduce morbidity and malnutrition, especially for children below 5 years old in the target area of the project. ไม่แต่บ่เห็นหน้าจอมาซอยนะ I don't see the screen, please help. And the objective is to ensure Houn district to have health services, and especially sanitation and hygiene. And the survey conducted in September to December last year, and the data collection method in quantitative and qualitative, which we interviewed the household with children under 5 years old and person with disability, and also conducted a group discussion. And the tool utilized is the form, paper-based form, including global collect through mobile phone in qualitative data collection. And the population, the sample population include we collected data mostly in Samoay because we have 60 target villages, and we focus on our target group mostly in Houn and Samoay, and the total household is 495 household, and we measure weight and height in comparison to the age, and including the mother, and over 400 children, including person with disability, 66 person with disability also participated in the survey. And the baseline survey results in terms of height and weight, age, or what is called anthropometric. I cannot show this upward. It's my high. We see that the mother reproductive age 15 to 49 years old, which is weighted than threshold. They have malnutrition and BCMI below 85. It's only 6% with 80.5, and the overweight is 30 plus. The BMI is the body mass is 1%. And the malnutrition in the target group in the two districts at the national level, the stunting is 33%. But if you look at the target group of the project, which is active 58 or 59% in average at the mean, which is very high, higher than national mean or average. And the children is under wasting is below 11% below national level, national threshold, and 24% is the national threshold, or and the project is higher. or 7% in average. And in terms of nutrition, if we look at the result, breastfeeding, exclusive breastfeeding within an hour in average of 38 or 32%, and at the national level, it's 50.6% at the national threshold, which is much further than national threshold. 6.8% of girls and 4.4% of boys in 7 or 23 months old consume 4 food groups daily, and 5.2% of the children overall is 5.2% receiving food. And in terms of pregnancy behavior, it's observable that the survey finding show that during pregnancy, what is the food taboo? When we ask them, it's mostly pickle foods, over 69%, and light green and dark green is Samoay, and fruit taboo, vegetable taboo, some vegetable and other food taboo, don't know and no response. It's some, and another taboo is the white buffalo meat or beef. Even chicken is also a taboo, and fish and seafood is, and we don't have any probe question. For example, if it's a beef taboo, do the eat chicken? If the person taboo is for everything, that person is at risk of malnutrition and transfer that problem to the children as well, not only the mother but also the children, the baby. And what about the food taboo? Do they avoid eating some foods? This is low here, but when it's here after delivery, there are more food taboo over here. It's the same. They were interviewed and discovered that if you don't eat beef, what about chicken? When we provide training or we do health education, we keep it in mind. If you have food taboo, it's for how long? The 6 months, the over 6 months, they still continue with the taboo is 17%, and Pak Bang district 34%, and below 1 month in Pak Bang is Houn and Samoay. I will make a change to my slide. This is Houn, not Pak Bang, in Oudomxay, which is in the south, which is less minimal than the north for the taboo. And the situation of the pregnant women when they do chores. The women reports that their husband help with the household labor. The dark blue, Samoay, green blue is Houn. Dark blue, women report that the husband help with the chore, which is substantial, which is 77%, which is a lot. They help with fetching water and fetching firewood is over 50%, and preparing foods, cooking for someone. The husband help the wife is 75%, but in Houn, the husband rarely do. The husband just lets the wife do the chore, and the heavy work is Samoy. It just provide little help in Houn, help with budding children. Samoy helps more than Houn, and budding children the husband thing is the wife's chore, not mine. And cleaning the house is the same as bathing children, and Samoay is more substantial than Houn. And cleaning the yard, cleaning the floor, and for Houn, the husband doesn't help, which is just 15%. The husband help, and the husband help nothing. It's Samoy is 4% and Houn 6%, and don't know and no response is 12%. 63% of pregnant women access annuity care at least 4 times. It's 63%. But in comparison to LSIS that we just received in 2023, it's 71%. So it's lower. It's lower than LSIS 3. It's still far away and need improvement. And 80% of pregnant women attended at least one ANC. This is for project, and for LSIS, it's almost 90%. 54% women receive postnatal care visits within 24 hours of birth, and for LSIT, within 12 hours, still in hospital, it exceeds 5%, which is the time is different, but I have a similar number which I can show you or compare them. Antenatal care is mostly they do it at health center. Houn is more than Samoay, which is 93% at the health center, and in Samoay it's only 73%, and they have access to mobile clinic. It's 7%. Maybe the villages are difficult to access, and some villages close to urban area, they come to district hospital, which is 35%. Birth practices delivery is the dark blue is the deliver at health center or health facility. Somewhere it's more than Houn, and Houn is only 42% and 58% is delivery at home or delivery in forest. And now I would talk about water, sanitation, and hygiene. I'm showing you LC3 number. Why we focus on this? Because I observed that the survey is done nationwide, was done, and the E. coli in defecate excrement is mixed with water. It's 70%. It is fecal contamination, and mixed with the drinking water, 72%. Is the contamination, and when people use water, they would touch the disease, for example, diarrhea, and that impact the children, and that would lead to infection and parasites. And parasite problem could happen if it is without hygiene. And use of safely managed drinking water is only 25%. And in terms of hand washing facility, washing hand with soap and water available at the national level is 63%, which is high. And access to latrine is 85%, which is national level. And for the project side, and number is 39% of households that have the target group of survey show 39%. Also, Samoy declare it's stop open defecation in 23 or 24. They announce stopping open defecation, but so when we do project or activity in health issue, we would plan, and when we achieve our target, declaration announcement was done, but they don't use latrine. They don't use the latrine. This is I already mentioned in our SIS shows 33% have access to latrine. They have permanent latrine without sharing to other villagers do not share their latrine. And 40% of households with hand washing facility with soaps and water available. When we did survey, the LC 63% is much far from each other. It's much far away from each other. This is children with diarrhea in the last 2 weeks. These are figures in Houn district, not as much as Samoay. Average is 25% in Samoay because they have their hygiene is not that effective, not good enough, and the drinking water, where do they get water? Is that is the outside in yard in the household is 9% in average at a mean, and in the home area in house in the yard 57%, and elsewhere 30 minutes away, walking away 27%, and Houn they have to walk further, more further in comparison to LC, which is 84%. The next question, we are in a year. When is your main source of drinking water? Drinking water is dry. Houn is more substantial. Some months they have no water available, which is 69% in 12 months. Some months are not available, and similar to Samoay, and sometimes they don't have access, and 65% they don't have access to. Yes, this is critically because of the drought, and sometimes there are floods, and in dry season, and water is not available. A lot of trees are cut from the higher mountain, and that impact the water availability. And in terms of, do they boil water, for example, how do they treat water, or do they have filter? Is the ceramic, or do they buy water? I mean, access to safe water. In average, it's 58%. If we, in terms of water treatment before drinking, and do they use the safe drinking storage? Only 43% use the safe water storage or container, for example. And in terms of sanitation service level, for example, improved toilet facility that is not shared to other villages or other household in average is 39% in total. And for Houn, not declared as the open defecation stopping is 44% during our survey time. And open defecation, Houn is 56%, Samoy 46%, a bit lower, but they use the unimproved toilet facility, but it's not the basic one. In terms of gender equity and social inclusion, we interviewed them. We asked them about participation in making decisions. We asked them, and 68% of women report that they participate in household decision, in purchasing, in major purchases. They can buy whatever they want. They are more involved in decision making, and below is the men. And men, 73% of men report that women in their district, villages, can make decision in major purchases. It means that women report that women is more have more involvement. But women say my participation is 68%. So this is the difference between men and women. And women report that 66% of them, they can speak up. They are confident to speak up. 66% think head of the village listen to them, listen to women when they make decision. And if we look at the number of men, it's lower. 52% of men report that women in their villages speak up at the meeting. Women say they're confident, but men say women are less confident. And 63% think that head of village listen to women or when they make decision, which is quite substantial, over 50%, which is a good percentage. 38% of women believe that women can be leaders at men, and which is similar to men, a bit lower, 5% lower. The 33% of men believe that a woman can be a good leader like a man, but it's still lower. But it's only 33%. We ask them, do you think women and girls in this household feels comfortable using the toilet when they are menstruating? And the answer is yes, they feel comfortable if they have their own latrine or toilet when they menstruate, or they can do cleaning in a more private manner. 82% in Houn and 73% in Samoay. And we ask about gender. We ask them the division, gender division. So who fetch the water often in the villages, in the two districts, with almost equal. Samoay is dark blue and Houn is light blue. The adult women and men, and followed by adult women do fetch water, and for children are not minimal, and mostly it's the adult men and women do fetching water. In terms of gender division of the tasks in household, the question is asked if men should help with the chore around the home, like fetching water, cleaning toilet, or taking care of children. Women is 41%. They think it's their task, and the women say it's the work of the man. It's 45%, a bit lower. And if it's the task of the women, and they say yes, 59%, and 55% of them think that it's only the work of women. And in terms of participation and decision making in household, for example, to construct a toilet, who decide? And men and women together say it's 50% in Houn and Samoay is more than Houn for the responses. And adult man is only adult men who decide to buy toilet. It's 39% in Samoay and 50%. So it shows that the decision making is mostly depend on man. This is about buying food, money that's spent on food, on household, in community. Who do you think make final decision about spending on food and stuff in household? The electricity is gone in our office. Please hold on. We ask the question, who buy the food? Who decide to buy the food? And they say women and men, and mostly it's the women who decide to buy food. 62%. This is Houn, light blue, and follows by adult men. Only men decide is 34% perceived like that. And then I will skip. And the question on, do you think men and women should make a final decision about what to spend money on? And men and women should make decision together on spending the money for the family. And if so, women say it's 32%, but women respond that it's only 17%. Man and woman should do together. So it's still only one gender. The perception, belief is still one gender to decide. So men should ask women what they think before making decision. When the response is 41% think we should ask them first, and the women think they should ask the women. It is 51%, and the man should make final decision to spend money on the stuff, and the man perceive that when yes, 27%, and the even women support that it should be the men to make final decision. So women perceive like that men should mostly make decision, and for both men and women should attend community meetings about wash, and the response from male agree. The man agree it over 60%, and it's the same for women. They both agree, and only men should attend community with meeting on water, sanitation, and hygiene. And the response of males say is 32%. It's only men, and women say it yes, 37%. But the finding are good. The finding are good, equally good. And this is women can go to community meeting and just go, but only listen without speaking anything, and without sharing any lesson. And the male respondent agree. The 32% of them agree, and it's same for the women. And apart from that, two of them go to the meeting, but significantly, it's just for listening. And women can speak up and share their idea at community meeting. And just the same like as men, whatever the man say, the women just say okay, and it's similar. So they are similar in parallel, and whatever the man say and the women agree. And this is a survey by Plan International and Civitas. And significantly, we want to emphasize that the work on nutrition, we want to keep in mind on water, sanitation, and hygiene, and gender role. So when you do project, you want to keep this in mind into your planning and implementation. This is the end of my presentation. Thank you. Madam Gates, Sister Gates, do we have any question, comment on the recent presentation and the topic? Feel free to exchange. Feel free to let us know if you have any points to make. Good morning, this is Somphorn. I have some points to make. Do you hear me? Yes, it is clear. I am Dr. Somphorn from Tropical Medical Institution. Thank you for sharing useful information, which is uh, an information that you have conduct a survey. If you would elaborate on the all target villages that are the target village of plan, right? Yes, it is the target village within the two association. And during the survey, there are no intervention. Is it in which year? Because I haven't seen the 9 September to December 2023. So which is during the rainy season, because I observed some information, some data, the number of sample size of the two provinces, which is different, but it's finer. But in terms of food table, it looks interesting. I'd like to know in calculation of percentage, what do you based on the number of villager? Because some villager have multi-table. They have multi-table with shell, meat, and fish or some vegetable, because this is the percentage calculation. Because how do you do with sample size? Is the individual based or is the number of individual? And secondly, I have seen the disease diarrhea. This is still seen. Maybe it is because of the season or it's not the non-season rationale. And in terms of latrine or toilet, they still have open defecation. They still do open defecation, which is still high, 56%, and safety and cleaning. You talk about the term safety and hygiene before. At the moment, you spoke about open defecation. Can you explain more with the safety and hygiene? Doctor, you are a researcher, right? I will try to answer your question. This is the pregnancy behavior regarding food table. And there are multi choices. So one person responses are multiple. And more than 4 table, how many person have more than 4 table? One person can be 4 food table, or 2 table. We don't do individual basis. We don't calculate individual basis. And so this is the percentage. And you talk about the diarrhea. for diarrhea, it's not during the rainy season. So it's not the season factor or season base. But well, it's about the environment of the villagers themselves. They practice open defecation 56%. So the excrement are around the villages, and there is still contamination, and there are pigs, there are chicken around, and the excrement might go to the river, and it might be transmitted to the hand. Apologize for someone who just eat food, and the hand are not, some hand are not washed with soap, and sanitizer, let's forget that, sanitizer. And when after going to forest for open defecation, and before they cook, and do they wash their hand? Because these are relationship and correlation factor that are linked to each other, and is September to December. And your question on open defecation, is it over here? You mentioned the term safety and hygiene. Do you mean water? Do you mean what is the factor? The term you say before open defecation, I heard some terminology. Maybe it's about water sanitation and hygiene, and the safety in this sense is about water. It's about drinking water, and household apply safe method of water treatment, make it clean, make it hygienic. They boil water. They have therapy. It's like a ceramic ceramic can, a container, and then they would take the drinking water from the container reservoir. And this is not solar. This is not solar. And in the sunshine, because then they need to be in the sunshine for 6 hours, and that method is not possible. So we don't ask question about that method. And in terms of safe method here, they already boil the water, and we look at the storage. If the storage is clean, we don't test the contamination. We just observe from our eyes if there are dust or there are something in the water. Can I have another question? Yes, sure. I have seen regarding the food table, it's also about to help with the work, showing in percentage. It's understandable that one individual answer a choice. If it is the number individual, it will be more clarified. For example, 30 villagers have food table with chicken. In percentage, I might understand that in 400 villagers, it's the food table or the 13. This is the percentage base, not the individual base. And many points that you have said, comparing between the two province and the district, but the sample size are different. How do you compare the results or situation of the two district? And comparing, it is possible to do comparison, but comparison with LC3, this is agreeable because, for example, 83% accessible to water sources, and for the project, it's 20%. and between the two districts and comparing between the two districts with the sample size 3 villages or 20 villages, and Houn 3 villages, and Samoay 20 villages, and the sample size are different. This is my point to exchange and share, and thank you for allowing an opportunity. Your points are agreeable because we don't select big sample size because only 10 villages, and Houn intervention is at 60 villages, but activity happen only in 10 villages. And yes, I agree with your point when we do assessment, but when we do sample size for 60 villages and 10 villages of the target group to be sample size. And when we do intervention, if this is good, it would interfere the results of Samoay. And Samoay district, if Samoay district don't do well, 50 villages don't do well, and I talk to the assessor, to the evaluator, is it possible because we want to randomize Samoay for a lot and Houn for some area. And your point that you raised, it's right. And yet it's hard to compare because this is 20 and this is only 3 for the two districts. And just we explained in the beginning that the two districts are different, but when they do division, they do, for example, this we do an average 53 household, and this is the percentage of Hue district. So it did the district base. And person with disability participation, this is for what reason? There are results but are not presented in this time. It's quite long because otherwise participant is hard. It's too burden to participant. And it is about difficulty to have access to services and decision making in latrine, clean water. Do they have any difficulty in having access, and how do they participate in village activities? That's why we include a person with disability. But we seem to talk less about person with disability for this time, but could be next time we talk more. Thank you, Sister Somporn, for your comment. Do we have any further comment, any further interest towards the results, the survey result? Thank you, Dr. Ketsadasak, for your presentation. I'm from Tropical Medical Institution. I like to share idea about open defecation and use of latrine. Do you have reason why they don't use toilet, latrine, but still practice open defecation? Because if we know the rationale of open defecation, so we can plan for improvement and provide appropriate health education in future. Another question for person with disability: what method? How do you ask them? Because some are deaf, some are blind. I mean, some even cannot walk. How do you interview them? Because I'm interested to know how do you extract responses from person with disability. Thank you, Dr. Jan Ali. Good question of yours. is to know the rationale of the person who don't use latrine. But for this time, I have some overall finding. They refer to the money reason. They have money problem. If they would pay for construction of toilets, but I haven't presented those findings for this time, and for the question on the rationale, I remove that because I'm afraid that you might not have interest, but still you have interest. And lastly, the question: how do you ask question to person with disability and their disability status are different? The village authority help her to select. They they broadened the list of the person with disability, and we did the interview. And if the person cannot answer the question, then the caregiver would answer the question for them, would help them respond to us. Do I answer your question? Yes. Yes, you did. Do we have any other question? Do we have any question? We still have some time left over, and the presentation and the document is shared in the chat box. Feel free to download it. Well, anyhow, it's not yet the final. I would want to revise it and make some changes, and you can share us the final one. I have some point side from GSI. I'd like to exchange. First of all, I appreciate Dr. Ketsadasak for sharing the finding, which is very helpful. I have some comments on the food taboo survey. Of course, there are traditional beliefs in food taboo, for example, avoiding eating white buffalo meat and eating fish with red tail. Do you do any survey categorizing which groups of food taboo? For example, they might avoid white buffalo meat, but they can have protein from some fruit, some type of fruits or other. If you've got one question, yes. I have seen the constraint of our question. We haven't categorized. We don't categorize or we don't classify. For example, one person can answer multi-choices. Yes, one individual can respond with multi-choices. We still have a gap. And your question is, I already mentioned, and there might be some gap. You have food taboo for buffalo, and but you eat something else to replace the protein, or you have this taboo of food, and you don't eat other thing at all. So this is the lesson for it, that we can add more question to make it more comprehensive. I haven't brought everything I haven't brought everything on the findings to present because otherwise it would be too tiring, exhausting to you. Do we have any further points to make? We are still open for 5 more minutes. We still open the floor to you for 5 more minutes. Otherwise, we still have some minutes left over. But anyhow, if you still have no more question, we would ask to close. Is it possible? Thank you so much, all participants, especially Dr. Kiet, for your information sharing and sharing the survey findings which are beneficial. It would be applied for the implementation and for our planning. And the head of the center has been engaged with other work, and I appreciate to all the speaker, all participants, and the interpreter, and see you again in October for the next topic. And you would follow the page of the health center, and we would communicate to you to engage your participation. Thank you. Thank you.